Erectile dysfunction is a very common condition. Erectile dysfunction is inability to have or maintain a satisfactory sexual intercourse. Nearly 1/3 of the males experience erectile dysfunction during their lifetime, and this incidence of erectile dysfunction increases as the age increases. Many males of erectile dysfunction directly resort to the expensive medicines for a short-term course correction. But a University of West research has found that Kegels exercise, if used correctly and consistently, may pay very good results, very good dividends in the bed for the treatment of erectile dysfunction. Today, in this video, we will discuss what are Kegels exercise for men, how they should be done, when the results of Kegels exercise start, what are the causes of erectile dysfunction. Good morning, I am Dr. Rajat and you have started watching our YouTube channel, The Fertility Gynecologist. Before I start my video, wait, did I say Kegels exercise for men? Most of the people who know something about Kegels, they would have wondered why this person is talking about Kegels exercise for men when it is meant for women, especially to prevent the incontinence and the prolapse after delivery. No, you heard it correct. I mean to say Kegels exercise for men. Sexual health basically depends upon the overall health. While erectile dysfunction medicines like Viagra or sildenafil may help for a short-term course correction, but the real problem, the underlying cause of the correction may be in the mind, the stress, or maybe in the heart or the general health. Kegels exercise are first line, cheap, risk-free, non-invasive and very effective method if they are practiced correctly, consistently, religiously, persistently, honestly, sincerely over a period of time. A weak pelvic floor basically causes erectile dysfunction. Most of the muscles of the pelvic floor, they surround the genitals and they have a main function in the erection of penis in males. Sometimes the spasm of pelvic floor also causes erectile dysfunction. In those cases, the pelvic floor muscle exercise do not need to be practiced, but pelvic floor muscle relaxation needs to be practiced. So first of all, you have to differentiate whether the pelvic floor muscle is in spasm or is weak. What are the causes of erectile dysfunction? Mostly impotence or erectile dysfunction is secondary. No man is born with a primary impotence. Most of them have secondary impotence, and most of them are lifestyle or dietary disorders. Obese, alcoholic, smoking, cardiovascular disease, uncontrolled diabetes mellitus, blood pressure, stroke, sedentary lifestyle, all these are the causes of erectile dysfunction. Apart from that, as we grow older, the pelvic floor muscles become weak. In all these cases in which there is an increase in intra-abdominal pressure like chronic cough, chronic smoking, bronchiectasis or chronic constipation, or there is a injury to the nerve supply of the pelvic nerve organs like perineal injury. These are the causes of weak pelvic floor muscles and thereby leading to the erectile dysfunction. While the conventional medicines for erectile dysfunction, they target only the hormones or the vasomotor factors like Wessel's factors. But mechanical factor of a pelvic floor muscle strength is very important, and that is where the importance of Kegels exercise lies. Pelvic floor muscle rehabilitation is all about technique. It is about muscle power, endurance, relaxation and continued combination of above. This pelvic floor muscle exercise PFME involves the closure of pelvic floor and lifting of pelvic floor. This is very, very important. Pelvic floor, if you see the anatomy, I'll put a picture it besides. Pelvic floor is like a hammock shape and it supports the bowel, the bladder, the rectum and everything. And there are 2 openings in males and 3 openings in females. In males, the anterior opening is for the urethra and posterior opening is for the rectum, and it is a hammock shape. I'll come to the detailed anatomy a little later. Kegels exercise are basically those exercises which strengthen the pelvic floor muscle and thereby support the bowel and the bladder function and also the erectile function. Pubococcygeus, iliococcygeus, ischiocavernosus and bulbocavernosus are the main muscles which are involved in the erection. Ischiocavernous is the main muscle which is important for building the intracavernal pressure and thereby imparting the rigidity to the penis. And bulbocavernous is the main muscle which allows for the penis to engorge with the blood and prevents the outflow of the blood. It is also important for the urinary incontinence and preventing the dribbling of urine. The University of West study found that 40% of males who are doing Kegels exercise, they get better results, and in another 33%, they significantly improve their erectile function. A bit about Kegels. Why we call it as Kegels exercise? Basically, it is named after a scientist called as Arnold Kegel. I would like to call him as Sir Arnold Kegel in 1948. He basically was a gynecologist and who invented this exercise as a measure of postpartum exercise, especially for females to prevent the incontinence and prolapse. And that is why in the introduction of my video I said, wait, these Kegels are meant for women. But actually, all human beings have got pelvic floor. It prevents the herniation of the bowel and bladder, and that is why this is very, very important. And in males, these pelvic floor muscles surround the genital organs, especially the penis, and which impart strength, and thereby they are very, very important. Arnold Kegel, he invented pereniometer, which was the world's first biofeedback instrument, and it had to be kept in the vagina, and the female was asked to contract the pelvic floor muscles, and thereby the manometer reading on the pereniometer was set, and there was a specific reading at which the females were told to contract and hold the pelvic muscles. He prescribed the pelvic floor muscles exercise to be done 20 minutes a day, 20 minutes at each time for about 3 times a day, approximately 50 to 60 contractions each set for about 200 contractions per day. And according to the historical textbooks, he wanted his patients to do these exercises for minimum 15 to 20 weeks to find some kind of clinical benefits. So what is male pelvic floor, which we are all talking about? This male pelvic floor is a complex structure which is made up of not only the muscles, ligaments, nerves, and the fascia. This pelvic floor plays a critical role in the sexual function as well as in the maintenance of stool and urinary continence. What do I mean by continence? We human beings are blessed with the ability to control our urinary and stool function. If there is no desired place, no desired time, then we can stop the urine and stool by contracting the pelvic floor muscles. And whenever our mind feels that there is a desired place or a right time to evacuate the urine and bladder, then we can relax those muscles, and that's where the continence comes. Apart from the pelvic floor, the urinary bladder, where it ends and where the urethra starts, the whole urethra is surrounded by a prostate which secretes various fluids, and along with the prostate goes the neurovascular bundle. This neurovascular bundle carries all the nerves, the veins, the arteries, which are important for the erectile function, and these are the nerves which are damaged during the prostate removal surgery, either in benign prostatic hypertrophy removal or in the radical prostatectomy for the cancer of prostate, which lead to the erectile dysfunction. The proximal sphincter of urethra, which is important for the ejaculation function, which prevents the retrograde ejaculation into the bladder, and the distal urethral sphincter is important for the continence function. There are 3 layers of pelvic floor. The superficial layer consists of bulbospongious, bulbocavernosus, superficial transverse perineal, and the external anal sphincter, and it is involved in ejaculation, urinary and fecal incontinence. The middle layer is a urogenital diaphragm. It consists of deep transverse perineal, sphincter urethra, and compressor urethra, and it is mainly important for preventing incontinence during a high intra-abdominal pressure in episodes of coughing or sneezing. And the deepest layer is pelvic diaphragm, which consists of pubococcygis, iliococcygeus, pubourethralis, puborectilis, rectalis, and ischiococcygis. This is the main muscle for the support of the pelvic organs, and it also imparts some kind of incontinence. This pelvic floor muscle is supplied by various pudendal nerves and sympathetic nerves S1, S2, S3, S2, S3, S4. These pelvic splanchnic nerves are very important for erection of penis. The erectile function is a complex interaction between the vascular system, the neural system, and the muscular system. They all play a significant role. Erection occurs when the blood flows into the corpora cavernosa, which is maintained by bulbocavernosus. The blood enters the corpora cavernosa faster than it can go out, and that is where the bulbospongious muscle plays a significant role. And ischiocavernosa, it maintains the hardness and the rigidity. That is why strengthening of these muscles helps significantly in erectile dysfunction. In normal males who have got good testosterone level, a normal penile health is because of good nocturnal erections, about 6 to 8 times during and every night. And this nocturnal erection is very, very important because it helps in entering of a fresh oxygenated blood in the cavernous sinuses, connective tissue, and the muscles of penis, and thereby maintaining the good health. There is a device which is called as a vacuum erection device. which have been approved as a non-surgical, non-medical treatment of erection. It consists of a cylinder with a pump that fits over the entire penis. There is a constrictive band which is over the base of the penis. This pump creates a vacuum and thereby allows the penis to be engorged, and constrictive band maintains this. This use of vacuum erection device is key to maintaining the penile length during the rehabilitative phase. It encourages the blood flow to the penis and thereby maintains the connective tissue extensibility. It may permit the penis to be rigid enough for a male to have a satisfactory sexual intercourse. The problem with vacuum erection device is that dropout rates are very, very high. Kegels exercise, they help not only in improving the erection, they also help in a better control of ejaculation and in preventing of the incontinence of urine and stool. They help by improving the blood flow to the muscles. They help by improving the good ejaculatory control and improve confidence. Now comes the most important part of this video, how to do Kegels. Before somebody attempts Kegels, they should know which are the muscles to contract. When we were undergraduates and postgraduates, this is how we were taught to explain to our patients how to do Kegels. Imagine that you want to pass urine or stool. There is no appropriate place to pass urine or stool. And then you have to contract or constrict those muscles which prevent the passage of urine or stool. So basically you have to stop the passage of your urine or stool. But while doing this, many males and females, unfortunately, they contract their butt muscles, the gluteus muscles, they contract their inner thigh muscles, and they contract their abdominal muscles, all of which are not technically correct. So a good verbal cue to the patients is, ask the male, you have to lift your penis, you have to hold the penis close to your abdominal wall. So you have to constrict those muscles which will bring your penis and thereby testis to close to the abdominal walls. In layman language, it is called as nuts to guts. So elevate the bladder, elevate the scrotum, and attempt to stop the flow of urine. This attempt also lifts the anus up, and you can test whether you are contracting the correct muscles or not by putting your finger into the anal opening and feel that the muscles contracting around your fingers. This is the correct way to do the Kegels, and identifying the correct muscles to strengthen is the first and the most important part of doing in Kegels exercise. Most of the people fail because they are not contracting their muscles, correct muscles, regularly and long enough. Once you have identified your muscles, nuts to guts, basically elevation of scrotum and bladder, then it is the time to perfect the technique. Focus should be there. Like I said, the abdominal muscles should not be contracted, the butt muscles, the gluteus muscles should not be contracted, and the inner thigh muscles should not be contracted. You should be breathing freely. So these exercises can be done in standing position, in sitting position, in lying down position, even in walking. It can be done anywhere, anytime, at any place. But the easiest position to learn when you are trying to do Kegels for the first time is lying down. Lying down on the back, hands should be on the floor, knees should be comfortably bent and pointing upwards. And then, like I said, try and draw penis inwards towards the body and hold it for 5 seconds and then release. Now squeeze the anus muscle as if you are trying to stop the bowel movement and hold for 5 seconds, then again repeat. Repeat this for 8 to 10 times and do 3 to 5 sets. The second exercise is floor lying on the side. Lie on one side of the floor with knees bent. Place a big and a thick enough pillow between your knees that they should be able to separate your knees. And then squeeze both the knees together, hold, and then release. While doing the exercise also, to find out whether you are doing correctly or not, just see whether you are able to stop the urine or not. The other variations, the knee fallouts, the supine foot raises, the pelvic curl. In knee fallouts, it is for the beginners. It exercise involves small movements. Lie down with the knees bent, feet flat on floor, and arms by side. Keep your spine in a neutral position with a small space between the middle of the back and the floor. Exhale. Squeeze the pelvic floor muscles with a small space between middle. And then slowly lower your one knee as far as possible, consistently maintaining the activation of the pelvic floor muscle. Inhale and then release the muscles. Bend the knee again. Repeat on the other side. Again do 8 to 10 sets. Supine foot raises. This exercise is an extension of knee fallouts. Position is same, lying down with knees bent, feet flat on floor, arms by side. Exhale, squeeze the pelvic floor muscles, and then slowly raise your one foot up while keeping the pelvis and the spine still. Inhale, lower your foot, and then repeat on the other side. Pelvic floor curl. is like a gluteus pelvic hip pelvic bridge. It is a common form which is done in the Pilates. The position remains same. You lie down with knees bent, feet flat on floor and arms by side. Keep the spine in a neutral position with a small space between the middle of back and floor. Exhale and squeeze the pelvic floor muscles. Then comes the important point. Tilt your pelvis towards the belly button. Just lift the pelvis towards the belly button. Press the back towards the floor. Then slowly lift your buttocks and push the heel into the floor. You are forming a pelvic bridge and your body should be supported on the upper shoulders. Take 3 breaths, squeeze and then relax. There is another extension of this exercise which is called as a side hip raise. It is a slightly more advanced and it should be done once when you have perfectly mastered the previous exercises. Begin by lying on your one side with legs bent and upper body supported on the elbow. While using your oblique muscles, raise your hips off the floor and ensuring that the body is in the straight line. At the same time, use your glutes and pelvic floor to elevate the top knee upwards. Keep hips off the floor and then count. Another variation which can be tried, which is not in the lying down position, but it involves the use of a chair. It is called as a single hip thrust. Once you have mastered the pelvic floor focused glute bridge exercise, begin with your upper body supported by a bench. Chair, the legs should be bent and the feet should be planted on floor. Make sure that the feet are at enough distance so that the knee hits a 90-degree angle upon extension. Lift one knee off the floor entirely and push through that supporting leg so that the hips are extended. There is a variation of a super Kegels in which you hold for at least 10 to 15 seconds, then relax for 10 to 15 seconds. It can be fast Kegels, you hold for a few seconds, 1 to 2 seconds, then again relax. Squats are also very good Kegels exercise. You stand shoulder width apart and then go. You do not go into the deep squat but go into the semi-squat kind of position. Diaphragmatic breathing or a belly breathing is also very good. It basically coordinates the diaphragm which separates abdomen and chest and the pelvic diaphragm. Important thing is don't hold the breath while you are doing Kegels exercise. Keep your abdominal muscles relaxed. Relaxation is very important between doing exercises, otherwise you may end up in pelvic floor muscle spasm and the whole point of doing the exercise may be lost. Consistency is very, very important. Practice these exercises regularly, every day, slowly increasing the repetition count and the hold so that you can improve the muscle strength in a safe and a measured way. Important thing is if the person is not doing this exercise regularly, then the muscles which have become strengthened, once you regain your erectile function, if you stop doing exercises, then again after a few weeks or few months the pelvic muscles may become weak and the erectile function may decrease. The most important and the most commonly asked question in my OPD is, if I start doing Kegels today, can I expect the results tomorrow? Answer is no. Any form of physiotherapy, for it to take some kind of results, takes few weeks. The timeline of the improvements in pelvic floor muscle exercise is between 1 to 2 weeks. You become more aware of the pelvic muscles. By the end of 3rd week to 4th week, there is subtle improvement in the erectile functions. There is a better bladder and bowel continence. At the end of 6 weeks, somewhere between 6 to 8 weeks, you are more confident of the erection. There are stronger erections, the better stamina, better ejaculatory control. And at the end of 3 months, you are more or less absolutely back to normal. There is a sustained improvement, stronger orgasms, better confidence. To keep getting good results from a Kegels exercise, one needs to make it a part of a daily routine. Consistent Kegel exercise routine. You can do Kegels while you are going to bed. It hardly takes 2 minutes. You can do Kegels while you wake up. You can do Kegels once you have finished your urination. You can also do Kegels while you are brushing your tooth. That is just to make a consistent schedule. We can do Kegels while you are coughing, while you are sneezing. You can also do Kegels while you are sitting, while you are driving. You need to make a part of the daily routine. People ask how many Kegels exercise should I do per day. Like I said, Sir Arnold Kegel said 20 to 30 contractions per time for 3 to 4 times a day. So 50 to 80 contractions per day should be done. You can do alternatively 1 time fast Kegel, 1 time slow Kegel. How a person should know whether the person is doing Kegels correctly or not. Like I mentioned before, if you are doing not holding this urine, lifting the anus. But most important thing is, if your back is aching after doing Kegels, if your abdominal muscles are paining, or if you are having headache, that means you're not doing Kegels correctly or you're holding your breath. Normal, correctly done Kegels should not leave you sore after the exercise session, should not have abdominal pain, should not have headache. So key is identify the correct muscles, relax and breathe in between. There should be a good relaxation also. And if you are doing incorrectly, it is better to stop doing Kegels rather than doing it in an incorrect manner. So are there any other exercises than Kegels exercise which help in the erectile dysfunction? Yes. Like I mentioned before in my video, erectile dysfunction is a lifestyle disorder, and lifestyle and the dietary corrections are very, very important. A good aerobic exercise for 30 to 40 minutes a day for at least 5 to 7 times a week works wonders in managing the blood pressure, in managing the cardiometabolic condition, in managing the diabetes, and which thereby has a good effect on the erectile dysfunction. Yoga is a very, very word in trending nowadays. Yoga basically helps for everything. It is absolutely essential in erectile dysfunction. It has got the multifaceted actions in the erectile dysfunction treatment. Well, the specific yoga techniques, they focus on the pelvic floor muscles. There are many benefits of the yoga. It helps in stress relaxation, thereby decreasing the level of cortisol and thereby improve the sexual function. It focuses on deep breathing and meditation. The relaxation techniques, again, build a tranquil, calm environment which helps in a good erection. And specific yoga poses, they involve the stretching and the contraction of the various muscle group, thereby promoting a good blood flow into the pelvic floor. And this enhanced blood flow ensures the optimal oxygenation of the tissues, thereby aiding in the expansion and the relaxation of the blood vessels, which is crucial for achieving and maintaining the erections. Like I said, it is important to know that if you start doing Kegels today, you may not expect results tomorrow. So Kegels, they are like test match. They give results in the good run, long run, not in the short run. They are not the T20 form. If you want the T20 like treatment, the shortcut treatment, Viagra is for you. But that cannot and should not be taken regularly without the supervision of doctors, because there have been incidences of various side effects. While a Kegel exercise, if it is done correctly, if it is done sincerely, it should ideally be the first line management, especially in the early erectile dysfunction. It can be done at home, anywhere, anytime. It should be done, I believe, every time for any male. There is something called as a pelvic floor muscle rehabilitation, which is done under a physiotherapist guidance. It not only involves the verbal cues like I mentioned before, but it uses the feedback technique. Earlier ones used to be pereniometer, there used to be lead cones in females, but nowadays an electromagnetic chair, an Emsella chair has come. For those males who cannot identify the pelvic floor muscles clear cut, who are not willing to do exercise, who are willing but they cannot do or are not able to find time, for those males, electromagnetic muscle chair for pelvic floors works wonders. Half an hour session for about 2 to 3 sessions, it gives 50% of the erectile function back to the males. In conclusion, I would say erectile dysfunction should not be treated just by popping a pill. Reclaiming your sex life does not and should not always involve the use of medicines. The Kegels pelvic floor muscles exercise are a great exercise to start with, which can be done anywhere, anytime. They should be ideally the first line of management of an erectile dysfunction. Along with that, good lifestyle choices like aerobic exercises, avoidance of saturated fats, sugars, refined carbohydrates, plenty of proteins in your diet, meditation, yoga, relaxation, and there is a very good place for a cognitive behavioral therapy. While Kegels exercise are a go-to and a first-line approach, they may not be the only approach. They may not benefit everyone. The results may vary for different people. And thereby the erectile dysfunction management involves a multifaceted, multifactorial and a multi-team approach, which not only includes a gynecologist, a urologist, a surgeon, a endocrinologist, a psychologist and a physiotherapist as well. A correctly done Kegels exercise with a proper consistency, it has shown to improve erectile function and an enhanced sexual well-being of a male. The results may not be apparent immediately, but with slight patience, with good focus and a consistent routine, in mostly about 70 to 80% results patients, the result starts appearing in about 4 to 6 weeks. Pelvic floor rehabilitation is as important as surgery, and 42% of the males of erectile dysfunctions improve after a pelvic rehabilitation, and 61% of the males, they are able to have a better ejaculatory control. They are able to prevent premature ejaculation after a good pelvic floor muscle rehabilitation. Therefore, I would conclude by saying Kegels exercise are natural, low risk, high reward, especially for the early stages. While they may not replace the medicines, but they are powerful, yet underutilized things. I would request you all to please like the video, to share the video, and to subscribe our channel. Thank you. Bye bye.